Do we know that activation response to language is the same when a child is asleep versus when a child is awake?
We suspect that it is because research of showing in 4 to 6-year-old children by Wilkie et al. Showed a very similar response to the same stimuli in an awake state versus a sleeping state. And so the areas that we observe are also the same areas that you see in older children and adults in a waking state.
So the really cool thing is that this is a very simple type of test. In passive listening, if you're awake and you're 6 years old, as Lisa described in your typical, you'll get this activation pattern. And if you fall asleep and you're a little 6-year-old, you'll get the same activation pattern. So it's passive listening, and so it doesn't require a task. However, the problem in providing a test like that in an awake autistic child versus an awake normal child might be that the awake normal child might get very interested and excited by this story, and the awake autistic child might not. So they might be in a different general state of interest, attention, and brain activation. So the other reason that the sleep fMRI is a very powerful method is it levels the playing field, and it provides us the opportunity to record the way the brain operates in a comparable circumstance for typically developing kids and for autistic kids. And more importantly, unlike fMRI studies that involve tasks and involve cooperation, it requires no task and no cooperation, so that high-functioning, medium, and low-functioning kids alike can all be tested in the same way, so that we can compare and contrast the abilities of the brain to respond to information, whether you're a low-functioning or a high-functioning person. It also means that we can compare to other types of disorders like language disorder or global developmental delay to see how they differ from autism. So it's basically a very nice, very simple, even playing field for us to look at brain differences.
We talk a lot about the fact that some populations are underrepresented in studies of children with autism, particularly children who have severe behavioral difficulties and can't go into the fMRI machine. Do you think this technique will help to expand the populations that are able to participate in studies? I would also say nonverbal individuals, because they often can't respond to language tasks. So do you think this technique will open up the possibility for them to participate?
Yeah, I want to say absolutely. I've been doing sleep MRI with little children since the 1990s. So for almost 20 years, we've been using this method on whether it's a baby or whether it's a 4-year-old, whether they're typical, whether they're high functioning or low functioning. So the answer is absolutely yes. And it's especially effective in the hands of really experienced people like Dr. Eyler, Dr. Pierce, myself, and 5, 6 different people in our laboratory. You know, on any given night, 3 of us go in. We're very good with kids. My nickname is the baby whisperer because if I hold a baby and just rock the baby and whisper to the baby seems to go to sleep. And so we've all developed a really nice method of working with parents and with babies, so that whether the baby is a nonverbal autistic person or a high-functioning 3-year-old autistic, we're very good at getting them all asleep. And it's actually a very enjoyable experience. It gives us a chance to be very close with parents and to really understand how they feel about their baby.
So what's the next step with this research? What's next for you and the other members of your lab?
Well, one thing that we would like to do is that because we have a longitudinal design to our Autism Center, we're following these babies up and we're scanning them twice a year apart. So one of the more powerful results of that design is that we'll be able to look at the same individual and examine how their patterns of activation change over time or do not change, as the case might be for the ASD folks. So that will give us a chance to look within individuals at this same time period to understand how things are changing. Another thing that we'd really like to do is to examine how these results in the brain function are related to things that we already know and that we're all finding out through this center in terms of brain structure. So we'd like to examine whether the connections, the physical connections between the hemispheres are altered in individuals with ASD and how that relates to our functional findings.
Mm-hmm. And I just wanted to add to what you were saying, which is that between the first time point where we image and then the later time point when they're a little bit older, we have treatment. So we'll be able to see whether there were effects of treatment that are associated with improvement or change. So those that did better, do they have changes in functional brain activations that are corresponding to the treatment outcome? So eventually we want to see if there are patterns or characteristics or quantitative differences in the abnormal responses that are predictive of the likelihood to respond well to treatment or the kind of treatment that might best normalize or improve language. And the other thing that we want to do is to refine this experiment. So this experiment already does a remarkable job of showing large differences between individuals with autism and individuals who are typically developing. So as a potential biomarker for early detection of autism, it already shows that it has very great promise. So what we want to do is work to improve the methodology that we apply, the types of stimuli, how we give them, when we give them, in order to maximize the ability to detect autism in a very reliable way in kids who are at high risk.
Well, that sounds incredibly promising. I want to congratulate you on your study and thank you for all the work that you're doing on behalf of families who are raising children with autism. Thanks for being here today.
Thank you.